Study after study has shown that with the rising cost of medications, that an increase in that patient out-of-pocket cost leads to worsening outcomes, leads to worsening adherence, and ultimately worsening care for the patients. So today, I want to talk about an innovative approach to this problem. Here at Surescripts, we've created what we call the real-time prescription benefit solution. And the way the solution works is it's embedded right into your Epic EHR prescribing workflow. Within Epic, as a physician is prescribing and has chosen the medication, the pharmacy, the dose, the physician is presented very quickly, within 1 to 2 seconds, information about that patient's specific out-of-pocket cost. So the price that you see in the EHR is the same price the patient would pay at the pharmacy. In addition to the cost of your choice, the physician is also presented with alternatives. It could be alternatives in the same therapeutic class on a different tier of the formulary. It could be alternatives where that medication could be delivered via mail order for a 90-day supply at a substantially lower cost. Or it could be alternatives that eliminate the need for prior authorization. With all that information, you can make a decision with the patient in a shared decision-making manner to choose the best clinical and economic choice for that patient. And all this information is presented in a neutral way, a way that's free of influence outside of the patient's benefit plan, and in a way that preserves that sacred process, that sacred place between you and the patient. And we're seeing great results with this. As I talk to providers, what they tell me is they're showing the patients the Epic screen, and they're making a decision with the patient when there's a significant difference in the price. From the data, we're seeing tens or even hundreds of dollars of savings when the physician chooses a different option. For more information, I'd encourage you to talk to your Epic and Surescripts representative, and they can talk to you about how you can incorporate this very quickly into your electronic health record.